Welcome to the module on constructing high-level test questions. In this course, we're going to talk about using objectives to guide test construction, how to use Bloom's taxonomy to guide appropriate level of test questions, the steps to item writing, and then you'll have some hands-on time to do some item writing and editing of test questions. The objectives for this course are to use course or content objectives to guide construction of test items, apply guidelines and principles for constructing high-level test items, and implement item revision to increase complexity of test questions. So when you are writing test questions, you want to use your content or module objectives in guiding those test questions. Additionally, those questions will map back to the course or program outcomes. An example of this would be, here's a content objective from a course where the nurse should provide education to a client or family aimed at health promotion for clients with respiratory disorders. The student learning outcome for that course is implementing the nurse's role in health promotion and health maintenance. You can see the test question is looking at a client with a new diagnosis of cystic fibrosis, and when teaching the family what nutritional needs specific to this condition about supplementation should the nurse include. And that would be vitamin K. So when we're talking about actual test construction and using principles and best practices, a couple of things that you want to keep in mind are making your test questions appropriate to the cognitive level of the student. Most of the time we want to aim for application level or higher using Bloom's taxonomy. There are going to be some situations like when you're providing brand new knowledge that you actually want to hit the knowledge level. You may use knowledge level or understanding level more frequently in like J1 level than you do in some of the upper level courses, but mostly even in those lower levels you're still mostly going to be aiming for application level or higher. This is an example of an application level question. So as the nurse taking care of a child who's been hospitalized for 3 days with dehydration, what abnormal finding would you report to the physician? So you're looking at information, and then you are trying to determine what that information is telling you and then apply that information to when you should try to report those abnormal findings. Secondly, the next thing that you want to consider are general test guidelines for following best practices. We're going to talk about those specific things later on as we go through the steps of test construction. The third thing that you want to consider are standardized testing guidelines following those best practices. So what are the best practices for NCLEX testing, for example? And these are things like, I'm not going to read all of these to you. You do have access to this document in the Google Classroom, but things like using words like client instead of patient, using primary healthcare provider or primary provider instead of doctor or physician, what words you should bold, because that's the way that they do it in the standardized testing format, and how you should make those words look like select all that apply as opposed to capitalizing that phrase, for example. Using generic brand names for medications as opposed to name brands, things like that. There are also available to you, this is the the certification handbook for the American Academy of Nurse Practitioners. And in this document, there are all kinds of information about the exam itself, including some sample questions that you can look at. However, they do not provide any standardization guidelines for how to write questions for this exam, but looking at some of these things may give you some ideas about how they write their questions. So this is also a document that may be helpful for you to look at if you are writing graduate level test questions. All right, so let's talk about the steps of item writing. So the first step we've already talked about, which is identifying content to be tested, which should come from your content or your module objectives and your course outcomes. The second step is to write the STEM. The STEM is going to be what behavior you want to see from the nurse. Do you want them to assess something? Do you want them to implement an intervention? This is going to come from using those verbs, those cognitive verbs from Bloom's taxonomy, and we'll talk a little bit more about that in just a minute. Step 3 is going to be to develop the answer and the distractors. Keep in mind, and we'll talk more about this in a minute too, but distractors must be plausible, and your correct answer must be distinctly correct. Step 4 is going to be to write the rationale. Your rationale needs to provide support for the correct answer, and it needs to promote clinical judgment and decision making, and it does that by providing rationale for the incorrect answers as well as the correct answers. And then step 5 is to peer review and edit or revise the questions coming from that process. And we'll talk a little bit more about each of these steps as we go. So I want to talk a little bit about Bloom's taxonomy. I think most of you are familiar with this. Probably you have seen it most commonly in that inverted triangle where the lower level questions are on the bottom and the higher level questions are on top. I like this format because it shows you the continuum of lower order thinking and higher order thinking. So lower order on the left and higher order on the right. And typically when we think of a continuum, we think of that left to right thinking. But I kind of like this depiction of it. But remember that we're aiming kind of here, at least application level most of the time. So this gives you, again, some of those cognitive verbs that you can be using when you're writing your test questions. And we're going to do, you have an activity. So there will be an activity for you to do later that will help you kind of apply these and determine lower order versus higher order thinking that hopefully you will find beneficial. That's what I was just talking about. All right, so just very quickly, the anatomy of a multiple choice question, the STEM, which we talked about a little bit already, which presents the clinical problem or the question. This is what you want the nurse to do. The key, which is the correct answer. Distractors, which are your incorrect options. And then the rationale, which we've also talked about, explains why the correct answer is right, why the incorrect options are not right. So let's talk about step 1, which is writing the STEM. You want to structure it as a question, not an incomplete sentence. That's your best practice. Ideally, it would be something that you could answer without seeing the options first. And present a clear problem. So you want to make sure you're leaving out any irrelevant or superfluous information. Don't put ages in there unless it's relevant. Don't make your question be gender neutral unless that's important to the actual question itself, things like that. You want to avoid writing your stems negatively. So don't ask questions like, what would the nurse avoid? What do you not want to do? Things like that. Identify, you don't want to write stems that will give cues to what the correct answer is. Don't inflate the reading level. Don't try to make your questions use big words and difficult terms, things like that, to make it seem harder than it really is. And also don't use slang terms or idioms that people may not know. And you don't want to use absolutes. So it always does this, it never does this, things like that. The next thing you want to do is develop your answer and your distractors. So how do you develop your distractors? First of all, base them off of items that are in your learning objectives, again, or learning activities that you have done in class, and use common errors or misconceptions. So if people tend to think one thing about an issue that you're talking about, use that as a distractor. You want to make sure that your distractors are homogeneous in their length, their context, and their grammar. So if your correct answer is in past tense, all of your distractors should be past tense as well. Things like that. Avoid overlapping distractors. So if your options are 1 to 2, you don't want them to be 1 to 2, 2 to 3, 3 to 4. It needs to be 1 to 2, 4 to 6, 8 to 12, whatever, things like that. You don't want your distractors to overlap. Also, don't use all of the above, none of the above, C and D, A and C, things like that. You want them to be standalone distractors as well. When you arrange your options, you want them to be in logical order. So alphabetical order, numerical order, time order, rank order, things like that. And also vary the positions of your correct options. So you don't always want them to be in the C position or the A position, whatever. Okay, when you write your rationale, this is really important because this is what helps promote decision making and clinical reasoning in students. Providing a rationale for why the answer is right, the correct answer is right, and why your incorrect answers are not right is what helps students understand and be able to compare and contrast the correct and the incorrect. So it's important for you to include that information. You want your rationales to be thorough, but you want them to be concise, and the guideline for this is 100 words or less. You also want to support them with references and not random references that students are not familiar with. Just like you wouldn't want a student to go and find support for their answers in some random Google site that you've never seen, you want to do the same, have the same courtesy for them. Finally, you want to construct your test and then have peers review them. You want your peers to look for clarity. Does it make sense? Does it read right? Content, is it correct? Context, and then errors. This helps to identify flaws. It helps to ensure some clarity. When somebody else is reading it, does it make sense to them too? You have been living with this content and this material, and it makes sense to you, but does it make sense to other people? And then it also provides some content validity, and that's what's really important as well. Okay, so there's going to be some other activities in the module that are going to allow you to have some opportunities to look at test questions, identify what is right or wrong with them, have some opportunities to rewrite some things, do some editing, and then we're also going to have some face-to-face activities for you to do some hands-on practice in revising test questions and writing your own test questions. That's hopefully going to give you some more confidence in how to do this test construction, item writing. So look for that coming in the fall as well. So today we talked a little bit about test questions being constructed from content objectives. We talked about constructing them at a cognitive level of application or higher and following best practices. We talked about the steps of test item construction. And then we talked about some activities that are going to be available for you to get some hands-on practice with that, and then some face-to-face practice that will be also coming in the fall. Thank you.